Thank you all for coming out on this beautiful morning for a very exciting announcement for the University of Louisville today. If you could please join me in welcoming the University of Louisville President, Jerry Bradley.
I wish I could do one of these every day. Well, thank you so much and good morning. And really thank you all for being here, for this moment, for our university and for our city. I want to begin by recognizing the many people and partners who made today possible. Our faculty, our staff, our students, our healthcare and community partners, but most of all, our elected leaders, our donors, our philanthropic champions, and everyone who believes in what the University of Louisville can do for this city and beyond. Today is more than just groundbreaking. You know, our vision statement at the university is it's where excellence and opportunity converge to drive transformative progress in societal well-being and health. And it's all reflected in this building. Louisville stands at a pivotal moment, a moment that calls us to bring together education, research, and patient care around a shared mission: healthier people, stronger families, and more a resilient region. It's a moment that aligns with the needs of our workforce and the urgency of improving health across our Commonwealth. And it is a moment when bold investment, like the ones that we are celebrating today, give us the power to recruit and retain world-class talent and to build transformative partnerships across industry, philanthropy, and government. To do this, we must think differently. We must create a place where collaboration is inevitable and where disciplines converge. That is exactly what this new Health Science Center building is all about. It will be a shared home for discovery, innovation, and impact. This facility will accelerate transdisciplinary research and directly improve lives. It will expand our capabilities in clinical science, population health, digital health, precision medicine, and health services research, supported by integrated spaces and shared resources designed to bring people together. Just as importantly, it creates an ecosystem where collaboration with industry, startups, and clinical partners can thrive, and where ideas can move faster from concept to direct patient care. And in doing so, it will elevate the University of Louisville's national and international reputation as a leader in health science discovery and education. But discovery alone is not enough. We must prepare people to carry that discovery forward. This is why this building is designed not only for research, but for learning at the highest level. Here we will train thousands of students each year, future nurses, clinicians, researchers, and healthcare leaders. They will gain hands-on clinical experience, critical thinking and communications abilities, and discover that teamwork is essential for modern, comprehensive care. Students will not just learn here. They will experience immersive, real-world techniques. They will be mentored by leaders in the field, and they will graduate ready to lead with both empathy and evidence in a rapidly evolving healthcare system. And these graduates will step into a stronger, more connected health ecosystem because this building is about partnership. This will be a shared destination, a place where hospitals, clinics, community organizations, public health agencies, and researchers come together with purpose. It will serve as a catalyst for regional economic development by creating jobs, expanding workforce training, and opening doors for local and national partners. And just as importantly, this school work will extend beyond these walls into neighborhoods, schools, workplaces across our region. Because our commitment does not stop at the campus boundaries. It reaches into the communities we serve, to the Commonwealth and beyond. So today we're not just breaking ground. We are building something far more meaningful. We are building a healthier future for Louisville and for the Commonwealth of Kentucky. A future where discovery leads to better care, education leads to greater opportunity, and partnerships lead to stronger communities. The Health Science Center building will be the cornerstone of that future, uniting people, purpose, and possibility. And it will stand as a testament to what can happen when a community comes together with a shared vision. And thank you all for being a part of that vision. And now it is my great honor to introduce a leader who has consistently championed progress across Kentucky and supported institutions like ours and this building, our Senate President, Robert Stivers.
Thank you, President Bradley. And as I look across through here, I'm trying to find out how many people wore their pens today. But let me say this. This is a good day. This is something that from my perspective and with my colleague, David Osmer, as Speaker of the House, talk about how we do research and how things come together and how we can be the epicenter for a lot of different things. We've passed a couple of bills in the past few years that looks at this to try to create the research dynamic, pushing universities together to think about how we can deal with cancers, weightless environment on tissue regeneration, all the different things that we need to look at and see to have better healthcare indices in this state. So when asked to come here and to think about the money we put in with our partners in the House, it was easy to say this and say yes to come to the University of Louisville. As a politician, a lawyer, I'm going to be really brief because what I'm going to say is this. This is a good day for the University of Louisville, which is in Louisville, but for the state of Kentucky. That's what we're here for. Go Cards. And I have to forget him sometimes because we don't always get along. I'm glad I got people laughing. It's rare that I do that. But truly, nothing happens in Frankfurt without a good collaboration, a good partnership. The Speaker of the House, person who is right here next to Louisville in Oldham County, Speaker David Osborne.
This is the story of my life. Spend the entire session waiting on the Senate. Well, thank you, Robert. Dr. Bradley, thank you. Great to be here today. It's always fun to show up at a groundbreaking because it symbolizes the beginning of something new and important, and it brings energy to things. And this groundbreaking is not the beginning of things. This actually started back in 2023, 2024, when we were first presented with the proposal to fund this facility. And so this is kind of the culmination of that commitment and the promises that are kept here. But in 2024, when we included this budget, or this language in budget, we included the funding, we did so much like we do every single budget issue. And that's by asking the question, starting the conversation with, show us your business plan. And that takes people back sometimes because a lot of times you get the response of, well, everything's not a business. Everything can't run like a business. Medicine is not necessarily run like a business. And while that is true, I would submit to you that the underlying principles of business remain true. And that is a return on the investment of taxpayers' dollars of the Commonwealth of Kentucky. And it is our jobs to make sure that we are protecting those taxpayer dollars, getting the best positive results that we can possibly get. And when asked what that business model was, the vision quickly came to light. and that is to improve health outcomes of the people of Louisville, the people of Kentucky, and to treat not only illness, but to create a system that fosters wellness. And that is so incredibly important in today's evolving medical world that we find ourselves in. I mean, it's stunning to me to think about how far we have come in such a short period of time, and things that were not imaginable even a few short years ago are now commonplace. And we continue to budget with that in mind. We continue to make investments in Kentucky that will continue to serve the people of Kentucky. And one of the other things that we invest in primarily is workforce, and understanding the incredible workforce shortages that we have across Kentucky. It plagues every community in Kentucky, but particularly in the healthcare space. Buildings like this, investments like this, are going to yield incredible results. So while this is the beginning of construction, it's also the beginning of I think building a better future and better outcomes for across the health metrics of the people of the Commonwealth. I will not forget Mayor Greenberg. It is exciting to be here, first of all, because there is so much energy that is taking place in this part of the city, and it's so great to see that energy. And I will tell you that is, in large part, in response to the vision that Mayor Greenberg has laid out for the city. It is an absolute pleasure to deal with Mayor Greenberg on a daily basis. He has such a great vision for the city of Louisville. He has been such a great partner of this legislature, working with us hand in hand to see those visions come to fruition. It's my pleasure to introduce him as well. Thank you.
Well, thank you very much, Speaker Osborne. It's great to be with you, President Stivers, President Bradley, and everyone else who has helped make this project happen and is going to be working in this building, for this building, around this building for the coming decades to come. I really want to echo thanks. That's where I want to start. Thanks to everyone at the University of Louisville and all the donors and the team that has brought us to this far. And thanks to the Speaker, to the President of the Senate, to the other representatives that are here with us today, and everyone in the General Assembly that knows that an investment in Louisville is an investment in the entire state of Kentucky, and that when you invest in Louisville, Kentucky wins. That's what this is about. This is just one example that you can even see from where we're sitting of this investment from the Commonwealth of Kentucky in our city. Just right to your left, my right, behind the building, we just recently opened LouMed Commons, a brand new park in the heart of this LouMed district that would not have been possible without funding provided by the Kentucky General Assembly to the city that we invested in LouMed and in downtown Louisville. We know, and that's just a little bit of what's coming, and it's paying off. We have meetings in the coming weeks with folks that are looking to build more housing in and around LouMed. You've heard announcements this year that are just the beginning of new companies like Glove US that are going to be manufacturing surgical gloves, onshoring them in the United States, in the LouMed district, in Louisville, Kentucky. Businesses are going to be creating jobs here. More people are going to be living here, and that's the result of investments that we were able to first make thanks to the Kentucky General Assembly. So thank you all so much for your investments in the past, for your investments that were just made over the past couple of weeks. We will continue to be good stewards of these funds. We will continue to invest in the heart of our city in a way that benefits all of Kentucky. This building itself will do the same. This building, the UofL Health Sciences Center, is a bridge that connects people, discipline, campuses, uniting all parts of the Health Science Center schools right here in LouMed. Because we know that just like when you're working to get anything done, you can't achieve great things in silos. We learn together when we're working together, when we train together, when we practice together. And that's what's happening right here. Truly a world-class, cutting-edge innovation and education is going to be happening in Louisville, Kentucky. And what comes from this, none of us probably even know yet. And that's also exciting. But we know that we're going to have great minds, students, teachers, researchers, clinicians, and others that are working hard every day here that are going to make our city, our state, and our entire world healthier. So once again, thank you all so much. This is a great example of the types of partnerships that show we can accomplish great things when we work together. And we are only getting started here with the University of Louisville, elsewhere around downtown, and all across our entire city. I'm so excited about the future of this building and the future of our entire city. And with that, someone else who is working incredibly hard to ensure that Kentuckians are healthy every day. The Secretary for Health and Family Services, Dr. Stephen Stack, has a challenging job working in the healthcare world these days when it seems like the rules, regulations, and fundings change by the week. It is still his responsibility and the responsibility of his cabinet to keep working to make sure Kentuckians have health care that they can access, that they can afford, that helps keep them and their families healthy. And that's exactly what Dr. Stack is doing every day. It is my great honor to introduce the Cabinet Secretary for Health and Family Services, Dr. Stephen Stack.
Thank you, Mayor Greenberg, and good morning, everyone. It's terrific to be here. We have 4 students up here representing the College of Medicine, the College of Dentistry, the College of Public Health, and the College of Nursing. And as an emergency physician and a former public health commissioner, it's a real treat and a real joy to be here to celebrate a building like this. I'm a liberal arts graduate from the College of the Holy Cross. I talk during my press conferences about Latin and Greek and history and all sorts of other obscure things. I am a strong believer that some of our best ideas, some of our most creative solutions come from this cross-disciplinary collaboration, and to have all of these disciplines under one building collaborating together, I can only imagine as educators must be an exciting proposition, but certainly as someone who's now involved in government and needs and relies upon the talent and the ideas of individuals like this, it's a really, really exciting proposition. So I hope for those who follow you, since this won't probably be finished before you guys graduate, although maybe for some, I hope that this is a wonderful resource and provides an incredible learning community to support the people of Kentucky. For the Department for Public Health, the short version of our mission is healthier people, healthier communities. For the Cabinet for Health and Family Services, the vision statement says we're committed to a Commonwealth in which every Kentuckian reaches their full human potential and all communities thrive. I think those are things we can all get around and agree with. And as I look at the other guests here in the front row, I want to assure you, despite the difficulties and the tension that so often show up in media and social media and online venues, we actually do all work together. We actually do collaborate for the betterment of the Commonwealth, and a lot of good stuff does get done, and I think this building is an example of that. So don't get distracted by the inevitable show that happens in public a lot of times. Behind the scenes, we really do work together, collaborate, and work very hard to support the people of Kentucky. So this health sciences building represents a major investment in Louisville, but also a major investment in the Commonwealth. It is, again, a real privilege and a joy to be here to celebrate this with you, and I wish you all the very best and hope construction goes smooth, ahead of schedule, and under budget. So thank you very much. And it's now my pleasure to introduce the next speaker, is Dr. Jeff Bumpus, who's the Executive Vice President of Health Affairs and the Dean of the College of Medicine. Thank you.
Thank you all. We ordered this great Kentucky weather for you here today, so nice sunshine. Welcome in. And again, Dr. Stack, thank you very much, and all of our honored guests, President Stiver, Speaker Osborne, Mayor Greenberg, really a pleasure to have you here today. And you guys have been incredible instruments in much of the success that the University of Louisville enjoys now. As we come to the close of today's ceremony, I want to reflect just for a moment on what this groundbreaking truly represents. Yes, we're here to mark the beginning of construction of a new health sciences academic building featuring state-of-the-art simulation center, 64,000 square foot of interdisciplinary simulation, one of the biggest ones in the country. And yes, there's steel and concrete and technology that will rise on this site, and that's impressive. But what we are really breaking ground on here today is the future of health education, patient care, and impact on our Commonwealth and beyond. This building represents how we prepare the next generation of health professionals, these young people, not just to succeed, but to lead, to think critically, to collaborate seamlessly across disciplines, and to provide compassionate, high-quality care in the most complex and demanding environments. Simulation transforms the way we learn as a team. It allows students to practice in rare or high-risk scenarios. It strengthens the teamwork and communication necessary to be successful. It builds confidence and competence before learners ever step into a real clinical setting. Most importantly, it helps ensure safer outcomes for our patients and communities that we serve. This facility will be a place where physicians, nurses, and health scientists learn together, because the future of healthcare depends on how well we work as teams. But buildings like this don't happen by accident, and they never happen alone or in isolation. We are again deeply grateful to our leaders, donors, planners, architects, and builders who helped to turn this vision into the reality that it is becoming. A special thanks to a big part of our team, Champlin and EOP, Perkins and Will, and Messer Construction, for their continued commitment and real enthusiasm and energy that they have put behind this project, in addition to their collective expertise. Thank you to our faculty and our partners who helped shape the space grounded in real-world needs. And thank you to our students and our trainees whose curiosity, drive, and commitment and service inspire everything that we do and everything that we're about. This investment reflects a shared belief that education saves lives, that innovation moves health forward, and that preparing exceptional people is the most powerful contribution an institution like ours can make. This building also reinforces our momentum as an institution, our rising national profile, our growing research and clinical impact, and our commitment to excellence across education, discovery, and service. When future learners, this is the challenge part, guys, listen up. When future learners walk through these doors, they won't just be entering a training space. They will be stepping into an environment that says, you belong here, you are expected to excel, and you are prepared to make a difference. So as the hands go into the cement today, let this moment remind us of why we're here. For the students who will train in this building, for the patients whose lives will be touched by what is learned here, and for the communities that depend on a strong, compassionate, and skilled set of health professionals. So thank you for being part of this milestone. Thank you for believing in this vision, and thank you for helping us build what comes next. Now let's break ground on the future. Thank you.
Yeah.